Now, what about P2? P2 is the probability that a testing process failure generates incorrect patient results. Okay. Now, the probability of producing an incorrect result, which a lot of my literature tend to refer to as an unreliable result, so I'll be using both terms, incorrect, unreliable. They're supposed to be synonymous here. The number of unreliable patient results that are produced during the existence of an out-of-control condition that's the result of a failure mode occurring is going to depend on a number of things. It's going to depend upon the quality required of the patient results. In order to define what we mean by an incorrect or an unreliable result, we need to define the quality requirement for the result. It's going to depend upon the type and magnitude of the out-of-control condition. Was it a big out-of-control condition or a small one? Was it an out-of-control condition that is only going to affect a single patient specimen? Or is it the kind of out-of-control condition that, if it occurs, is going to adversely affect every patient result that's produced until you eliminate the problem? It's going to depend upon the power to detect the out-of-control condition. When the out-of-control condition occurs, if it takes us a long time to detect it, it's going to adversely affect a lot of patient results. And it's going to depend upon when, that is how often, QC evaluations are performed. We could have the most powerful QC rules in the world, but if the time between the out-of-control condition occurring and our next scheduled QC event, if 1,000 patient samples are tested, then 1,000 patient samples have been adversely affected, even though the power of our QC rule is 100%. Now, note, based upon all of those criteria, an out-of-control condition may result in not one, but many patient results being affected. Okay? So it's not a one-to-one. It's not one failure, one potential patient harm. It could be one failure, many potential patients being harmed, depending upon the size and type of the error and our ability to detect it. So we have to define quality. Jim's already alluded to this. The ISO 15189 says that laboratory QC should assure that the patient results meet the quality required for their intended use. The quality characteristic that we're typically interested in is a function of the magnitude of the difference between the correct result and what we report. The larger the difference between the correct result and what we report, the more likely it is that some inappropriate action would take place. The approach that we tend to take to this, introduced originally by Dr. Westgard, is the total allowable error concept. Now I have to ask you, Jim, I have made a point of trying to change the way I rephrase that to, I used to always say total allowable error, and now I keep saying allowable total error, because I think that's how you've been saying it, but in your talk you said total allowable error. So just tell me, which way should I say it? Allowable total error or total allowable? Okay, so that's how I've been using it in all of our papers lately. I've been using allowable total error. So, and the symbol that we use for that is TE, total error, subscript A for allowable. So you specify an allowable total error, and then if a result is produced and reported where the difference between what I report and what I should have reported exceeds that allowable total error, it's considered an unreliable or incorrect result, and the assumption we're making is that incorrect results create a hazardous situation for the patient. Okay? So this is the way you can think about the likelihood of an incorrect result being produced because of an out-of-control condition. So the center, the gray shade, the gray colored frequency distribution centered on 0 is meant to represent the distribution of measurement errors for a process that's operating in a stable state. It's in control. So the measurement errors are centered on 0, and the width of that distribution is reflecting inherent analytic imprecision. Okay. Now, if a failure mode occurs, resulting in an out-of-control condition that causes this process to shift, so that now our measurement errors are reflected in the solid black curve. And if we have specified our allowable total error, which are denoted on the x-axis, then the probability of producing a result that is incorrect, that's unreliable is the area under that curve that's outside the total allowable error limits. So it's shaded in red here. Okay? So for every possible magnitude of out-of-control error condition, there's a different likelihood of producing unacceptable results. While that out-of-control condition exists, every result is affected by the out-of-control condition, but it's not necessarily the case that every result will be considered incorrect, will fail to meet its intended use. It will depend upon the magnitude of the condition. In this particular case, it looks like maybe while this state existed and I was producing results, I might expect 30 to 40% of them to be incorrect. The other 60 to 70% would still have measurement error in them that would be less than what I consider the allowable total error. And you can compute, I can compute, you don't have to. I can compute for every possible shift, magnitude of error, what the probability is of producing unacceptable results if that out-of-control condition were to exist.